Venepuncture, also called phlebotomy, denotes the practice of collecting blood samples from a vein using a needle for laboratory analysis. The pre-analytical phase encompasses all venepuncture activities and is associated with the most pre-analytical errors. Pre-analytical errors include underfilled tubes, clotted samples, unlabeled samples, mislabeled samples, sample lost in transit, hemolyzed samples. During hemolysis, the internal contents of a cell are released from the intracellular cytoplasm to the extracellular fluid, which is the surrounding plasma. These intracellular contents include hemoglobin, protein, and cellular debris. Hemolysis may happen inside the body in vivo or outside the body in vitro. In vivo hemolysis is caused by biological factors that are difficult to prevent, some of which are hereditary. This leads to premature damage of the red blood cells, erythrocytes, during their normal life cycle of 90 to 120 days. In vivo hemolysis causes different degrees of hemolytic anemia. Hemolytic anemia is a disorder in which red blood cells are destroyed faster than they can be made. This could either be slow damage of the red blood cells over time causing chronic anemia, or sudden damage leading to an acute and life-threatening hemolytic anemia. Hemolytic anemias account for 5% of all anemias. Overall, fewer than 2% of all hemolysis cases are as a result of in vivo hemolysis. But this may vary by population. In vitro hemolysis accounts for 39 to 69% of all unsuitable samples received in the clinical laboratory, which is nearly 5 times higher than the next type of error, inadequate sample quantity. Pre-analytical blood sample hemolysis happens at 3 stages of blood sample collection as follows. 1. During sample collection, there are 3 things that may contribute to the sample hemolyzing. The equipment used, such as needle gauge. The anatomical site used, like when samples are collected distal to the antecubital fossa where the veins are smaller. The technique used to collect the blood sample, mostly when this is done via a cannula, needle and syringe, and prolonged tourniquet time. 2. During the handling and preparation of sample, any action which substantially increases turbulence in the preparation and handling of the blood sample. 3. During transportation and storage, like hemolysis happening during handling and preparation, hemolysis happens during sample transportation when turbulence occurs during the transportation process. Evidence shows that samples transported through the pneumatic tube system have a high rate of hemolysis than samples transported by hand. Turbulence during sample transportation also occurs when the samples are transported for long distances. The time the sample is left to stand could also cause the sample to hemolyze. This includes quick transportation and centrifugation, or prolonged standing time.